Good morning, everyone. Let's call court to order. Okay, today is Tuesday, January the 5th, 2021. It's 9 a.m. Proof of posting, please.
The agenda was posted on Thursday, December 31st, 2020 at 12:30 p.m.
Okay, at this time, we'll pause for a moment of silence. Will be faithfully praying that 2021 is much better than 2020. Uh, so I think a lot of people feel that way. So at this time, we'll have a moment of silence and then we'll do a pledge to the flags. Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Pledge to the Texas flag. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you. And I don't believe we had anybody call in for public comments. Okay, we have one proclamation Commissioner Miller has put forward. Commissioner Miller.
Good morning and Happy New Year to everyone. This is a proclamation that we're ratifying. It's already been presented to the recipient. It was a proclamation honoring Mr. James McCoy. Any of you all who love gospel music may be aware of the McCoy Brothers, a gospel group, a local gospel group here in Waco, McLennan County. But he did celebrate his 75th birthday, and it was an honor to present the proclamation recognizing him and honoring him. At this time, I just need to have the proclamation approved and placed in the record. And so I would move to approve the ratification of the proclamation recognizing and honoring Mr. James McCoy on his 75th birthday.
Second.
Okay, we have a motion and a second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you. Okay, I'm gonna hold a consent agenda just for a little bit here, and we want to get the update regarding the COVID-19. We have under M1, we have, I think Elizabeth on the line, as well as we have Stephanie Alvey to update us on the vaccines as well. So, Elizabeth?
All right, good morning, everyone. I'll go
Good
ahead and get started. I'll talk about testing. On 12/31/2020, we completed our federal surge testing program. On that last day, we were able to test 473 people at the Waco multipurpose facility. We were scheduled to be out at Heritage, but due to weather, we decided to move it indoors for that last day. Our total for the surge testing program was 34,519 people were tested. We met our goal. We were able to go a little bit over that 30,000, and it was a great success. And we were glad we were able to take part in that, and thankful for all our partners who offered location sites and critical testing during this time. We do recognize that testing is still important. We are still continuing to offer community testing. We are going through the state, and we are using a new system. It is called Docs Health. They are doing a saliva test, which is similar to what we were doing before. They started yesterday, and they were able to test 708 people out in Heritage Square. We look forward to continuing to work with them and continue to work with the state as long as they will offer and work with us for free testing for our community in McLennan County. They're going to be out at Heritage Square all this week. Next week, they will go out to WISD Stadium for a drive-through testing site. And then after that, they will be at MCC for a drive-through testing, and we will continue to build more locations as we move forward.
The Heritage Square location, I believe the time on that's 8 to 5, is that correct?
Yes, all of our testing sites are 8 a.m. to 5 p.m. Monday through Friday right now.
Okay, thank you. All right, any questions for
What is the
Elizabeth?
turnaround on this new docs?
The results are supposed to come back between 48 to 72 hours is what we are expecting right now.
I was curious as well, with the 34,000 surge tests done, what was the positivity rate out of those?
I do not know that information offhand, but I can find out for you.
Okay.
That'd be a good number to know.
And I think that number is on covidwaco.com, and it's updated daily, so that'd be a
It is. The last time I saw the number was as of January 3rd, and it had our daily positivity rate at 34% and our 7-day rolling average at 27%.
But is that all tests, or is that having them broke out? That's what
That's
I'm
all
asking.
tests. I'm not,
See,
I don't know if you give us the positivity rate for just the surge testing
okay,
at free sites, but that's for all testing.
okay.
Stephanie, is that number accurate? Is it?
The number that's posted on COVID Waco is for all tests, and it is accurate. I don't have the information on the surge testing.
I mean, it's 34%.
34%.
It's very high.
Okay.
Is that cumulative?
That's cumulative.
34% was from the testing done on the 3rd, and then as Commissioner Miller mentioned, the 7-day rolling average was 27 something percent.
All right. Anything else, Elizabeth?
Not at this time. Thank you.
Okay, and so we have Stephanie Alvey with the Public Health District to give us updates on the vaccine distribution.
Yeah, so do I go ahead and share my screen? Okay, everybody see my screen?
Yes, ma'am.
All right, so I'd just like to start off with this graphic. It kind of gives a good visual for the timeline that we're working under. And so everybody's kind of heard about the phased approach that we're taking with the vaccine distribution. And so we started out, in phase 0 is what they called it. And then we're currently in phase 1, and we're seeing the supply of vaccine kind of ramp up. And it's a very small targeted group that we're trying to get vaccinated in these initial phases. And so you'll see that we'll move into a place where we have a large number of doses available. We'll increase the number of people that get vaccinated, and then we'll start to see the supply steady out, and basically it'll be a broad access to the vaccine for any individuals that want it. And so the timeline that we're really looking at, to put dates to that graphic, is we got our first approval of a vaccine back in December 11th. We got an emergency use authorization for the Pfizer vaccine. And so that's when we started to get vaccine delivered into the states and then down to the local level. And then a week later, we had another vaccine that was approved. And so our supply is still relatively tight, but it's increasing. And so we'll be in phase 1, expecting to be through January, and then supply will ramp up, and we'll start to see larger numbers of doses available starting probably February into the summer. And then into the summer is basically when the supply will be pretty well readily available to the general public. And so in Texas, what that looks like is we're currently in that limited supply phase, and you can see there are some specific groups that have been identified and defined to fit into this initial limited supply phase. And I'll talk about those groups a little bit in a minute. I know there's been some questions and things that came up over the last couple of weeks that made some changes to that, so I'll cover that in just a second. Just to cover a little bit about the 2 types of vaccines that we currently have. So there are 2 vaccines on the market currently. They're both mRNA vaccines. The Pfizer vaccine is the one that was approved first. It was approved for people 16 years of age and older. The Moderna vaccine is the one that it's only approved for 18 years and up. And so both of the vaccines are 2-dose vaccines. I've had questions. People seem to think that for some reason the Moderna vaccine is only a 1-dose vaccine, but it's also 2 doses. So both of the vaccines that are currently on the market now require 2 doses. The Pfizer vaccine requires the second dose at least 21 days from the first dose, and Moderna is 28 days. Neither dose has a maximum time frame for the second dose, so you have to wait at least the minimum 21 or 28 days, but you can go beyond those to get your second dose. I mean, it's recommended to do it as close to the recommended intervals as possible, but there is no maximum time frame that you have to get that second dose. And currently, they do not recommend interchanging the vaccines, even though they're similar technology and type of vaccine. There's just no safety or efficacy data to support being able to get 1 dose with one type of vaccine and then the second dose with the other. So they do recommend if you started with the Pfizer, your second dose needs to be the Pfizer. If your second or first dose was Moderna, second needs to be Moderna. And then an additional item is that both vaccines should not be given within 14 days of any other kind of vaccine. So if you got your flu shot recently, you need to wait at least 14 days, or if you got your COVID shot, then you need to wait 14 days before you get your flu shot. They just recommend that 14-day waiting period between types of vaccines. And to just cover a little bit about what those critical populations that I mentioned. So I think everybody's pretty well aware that phase 1A was defined as healthcare workers. And so they broke this into 2 tiers. And the Texas has an expert vaccine allocation panel that they've assembled with subject matter experts from local health departments all the way through immunologists and others at the state. And so this group gets together and they have made these definitions for the state of Texas to work through as we start to distribute vaccine. And so they defined healthcare workers very specifically as being in these kinds of groups. So the first bullet here is hospital personnel. And so that includes not only the clinical personnel, but other ancillary and custodial staff, environmental services staff. So anybody that works in the hospital is included in that. And then they moved on to long-term care staff. Initially, the recommendation was healthcare workers, but the CDC's advisory committee on immunizations practices included long-term care residents in their definition. And so Texas adopted that and also included long-term care residents in their phase 1A in addition to the healthcare workers. Also included in phase 1A are EMS providers, home healthcare workers, and hospice workers. And then they moved on to what they called tier 2 in phase 1A, which was healthcare staff that work in outpatient settings like doctor's offices and other kinds of medical facilities. And then they moved on to pharmacy staff who are going to be providing the vaccine to the public, public health and emergency response staff that might be working or managing a vaccine clinic or testing site. And then they also included last responders, which are those individuals that work in mortuary services. Our medical examiners, so our JPs, are included there. And then also they included school nurses. So in phase 1A, school nurses are included, but school teachers were not included in this definition. And so that was supposed to be our initial group that we were targeting. And there was a lot of demand there. The hospitals, you probably remember, were the very first ones to receive any vaccine. So across the state, all of the first allocations went to hospitals. And so they all received it and were in the process of vaccinating their personnel. And then a second allocation came out and went to other non-hospital providers. And so then we saw a little bit of concern from the state level, and I think probably at the national level as well, that maybe the vaccine wasn't being administered as quickly as they had hoped. And so then in an effort to not or to prohibit anybody from being able to vaccinate as many people as possible to keep, people from waiting on healthcare personnel, they decided to open up phase 1B, which they defined as anybody age 65 years or older, and anybody that is 16 years of age or older with at least one chronic medical condition that puts them at an increased risk for severe disease. And so that's a pretty exhaustive list. They listed some specific conditions here, but it's not limited to these. And so that's a pretty large category that they included for us to be able to start vaccinating. And so their justification for that, because I think if you've been following from the beginning, a lot of us were expecting phase 1B to include like essential personnel or critical infrastructure staff. So that was like law enforcement personnel or government personnel, and anybody that was considered essential back down during the lockdown. We thought maybe those kinds of positions would be included in phase 1B, but Texas went a different route. And we're not the only state that did this. There were several other states that took a different approach. And so their justification for including phase 1B next after the healthcare workers was that basically there's very strong and consistent evidence that shows that people in this category are more likely to become very sick or die from COVID-19. And so if we can prevent the disease in those individuals, then we will reduce the burden on our hospitals and our healthcare systems, as well as reduce the mortality rate for this disease. And so that was really the justification behind moving these individuals into 1B above other critical infrastructure personnel. So anybody that works in critical infrastructure that has one of these conditions can still, of course, be vaccinated in this group. It just doesn't elevate a critical infrastructure personnel above somebody with meeting the definition for 1B. And so we've been on a little bit of shifting ground. Like I mentioned, we were all kind of under the assumption that we were going to be really focusing on phase 1A, those healthcare workers and long-term care residents to start with. So you'll see this first graphic that I have is what we were initially working under, that assumption. And then there was a little bit of a shift. And so now they've moved 1B up into this limited supply phase. And so that's created some confusion. I know there was a lot of demand for it, but I think what's important to note is that phase 1A, healthcare workers, there is still a lot of demand. It took a little bit more time maybe than I think people were expecting, especially on the hospital side, just because the vaccine can potentially cause side effects that look like COVID. So you can run a low-grade fever, or you can have chills and fatigue, or things like that. And so from a healthcare perspective, or especially from the hospital workers' perspective, if you went and vaccinated all of your staff right away on the first day that you received the vaccine, and then potentially, half of those individuals developed some kind of symptom and they couldn't come to work, then you would be really, in a difficult position from a staffing standpoint. So they had to slowly administer their vaccine to their staff in a very thought out and methodical way. And so I think that led to some concern that maybe the vaccine wasn't being administered as quickly as it needed to be. But in McLennan County, our hospitals got their vaccine out within the first 4 to 5 days after getting their shipment. And then our local others healthcare providers didn't receive their vaccine until right before the holidays. And so that makes doing some, really large scale type of vaccine clinics a little more difficult, just because it is the holidays. You're already, running from a short staff standpoint because people are out. So there weren't large scale vaccine clinics, but I don't feel like the rollout has been slow from McLennan County at all. I know when we got our vaccine, we immediately went for the next week, we got our vaccine the afternoon of the 23rd. And so then we, of course, had the holidays, and we initiated our vaccine clinic on the 28th and got our vaccine out within 3 days, which was 200 doses at the McLean County Health District. And so we've just been really working to make sure that we're following the phases that were set forth. We did receive this guidance from the state that said, you know, we are currently in phase 1A, but we don't want you to wait till you vaccinated all of your phase 1A individuals. You can go ahead and vaccinate phase 1B. But I think the biggest piece that I've taken out of this guidance is that once all readily available and willing members of the primary phase 1A priority populations have been served, then you can pivot and quickly move to start vaccinating 1B. I think the important thing to remember here is that the phase 1, there's still a lot of phase 1A healthcare individuals that are currently standing in line waiting for their vaccine. Phase 1B was invited to join the line, but they are still getting in line behind phase 1A individuals. And so we were able to give out all of our 200 doses to phase 1A individuals, and we still have a lot of people on the waiting list, agencies that have called us, healthcare facilities that have called us, that aren't enrolled as providers themselves because they don't have a large enough population, but they still want their personnel to be vaccinated. And so as additional vaccine becomes available, I think it's still important to remember that there are a lot of phase 1A healthcare workers that still want the vaccine, that are raising their hand, that are still waiting in line as well to be vaccinated. And so I just would encourage everybody to have a little patience. We knew that the vaccine supply would be very limited in these first few weeks. And so all the providers are working as fast and as hard as they can to get the vaccine out to the appropriate parties as fast as possible. And so I'll talk a little bit about what our local allocations have looked like. And I just want to preface that to say that all of the information I'm about to go over is public information. It's totally available, readily available on the Department of State Health Services website. I didn't put the link specifically on this page, but as you can see on the side there, every week they release a full list of all of the providers in Texas that are receiving vaccine and the number of allocation, the number of doses that they're going to get. And so if you're interested in looking further into any of this information, feel free to check out this website. DSHS has made a very concerted effort to be very transparent throughout this whole process. And so they want people to be informed and feel, you know, like they have access to the information they need to make decisions about this vaccine. And so our week 1 allocations, like I mentioned, the first allocation we got in McLean County was to our two hospitals, and they both received 975 doses of the Pfizer vaccine. That was not enough to do all of the staff within their facilities for either facility, but they were able to administer all of those doses. And then in the second week is when we started seeing some more community providers getting the vaccine. And so I think this is where we got a little confused about who they should be vaccinating, because the time that they got the vaccine allocated to them, we were still supposed to be focused on 1A, but then a day or two after we received the vaccine at their doorstep, then the definition and the guidance changed a little bit. So everybody was trying to pivot a little bit and trying to figure out how to interpret that new guidance and implement it locally in a fair and equitable way. And so as you can see, we got 2,700 doses in Waco or in McLean County at several facilities during that week. And that would have been the week that the health district received ours. So most of these providers didn't actually get their vaccine until right before Christmas, maybe December 23rd. Some of them, I think, maybe didn't even get their actual delivery until after Christmas. And then week 3, they announced some additional allocations to the hospitals. And these were a separate allocation, not to do their second doses, because this allocation was Moderna vaccine that they got. So they got an additional 1,500 to do the rest of their staff. And then they also could work on a lot of them have clinic systems, so they could work through some of their clinical staff as well in those locations. And then we just received an announcement yesterday afternoon that McLennan County was receiving an additional 600 doses at these different clinic sites. And so the way that each provider decides to administer these vaccines is really kind of up to their own processes, I'm sure they'll all focus on their own personnel first, but as you can see, a lot of them are probably going to be serving a lot of individuals in phase 1B. And so if you're a patient at any of these, I would definitely encourage you to contact the clinic and see what their plans are for vaccinating individuals in phase 1B. And so additionally, in addition to releasing the actual list of providers every week, they also have a map that they've published that has all of vaccine providers across the state, and the different colors are just different types of vaccine providers. And if you click on any of those dots, it'll give you the number of allocation they received. It'll have a little link to get to their website. So if you're interested in trying to find the vaccine in your community, definitely check out that map, and you can find out who's received a vaccine in your community. And just be aware, like I mentioned, that their supply may already be allocated or spoken for, and for the phase 1A individuals, or they may be keeping a waiting list. So just because they received a shipment doesn't mean it's automatically going to be available. And we're definitely not to the point. None of the providers that I'm aware of are taking like walk-ins. So if you're interested in getting a vaccine, definitely call ahead, because like I said, most of them already have a waiting list of either phase 1A or phase 1B individuals that have already asked to be vaccinated. And so I'm sure they're working through those lists on a first come, first served basis. And so just to touch a little bit on, what we're doing locally in terms of planning for the vaccine. I'd always like to mention that we have been planning for medical countermeasures, which does include vaccines, for many years. My program specifically here at the health department started planning for the mass distribution of the smallpox vaccine back in 2002 when we were concerned about bioterrorism threats. And so we have a lot of plans in place for that, but this vaccine is a little bit different. The situation is a little bit different. So our plans will have to be tweaked and changed a little bit to meet the current situation. But some of the other things that we've established in terms of planning is we did establish a local COVID-19 vaccine planning coalition. It's a very broad coalition. Really, the goal of that coalition is to make sure that we are communicating effectively with stakeholders in the process, both vaccine providers and other individuals who serve vulnerable populations, underserved populations, and making sure we're hearing all of those perspectives so that we can adjust our plans and adjust our approaches to make sure that we're equitably and fairly distributing the vaccine and making it available across our community as more vaccine becomes available, especially. And so another strategy that we're really focused on is promoting awareness and providing education on the efficacy and safety of the vaccine. We still do, even though we're kind of in a strange phase right now where definitely supply does not meet the demand. We have a lot of people that want to be vaccinated and not enough vaccine to go around at this particular point. We do anticipate, seeing some vaccine hesitancy in the community going forward. And so I'm trying to make sure that we're communicating effectively both about how safe the vaccine is and how well it works. And then also we're running into the issue of trying to help people understand where they can get vaccinated at this point. And so communications campaigns, there's a lot of efforts going on both from the health district's public information office, and then the City of Waco's mayor's committees have some strategic communications committee that's been working on some messaging for that. And so if you're interested, just definitely feel free to reach out to myself or Kelly Crane. And if you have ideas, they've been working on a lot of really fun and interesting efforts. And so those should be coming out here in the next few weeks, both with PSA type videos and radio advertisements and social media advertisements. And so be on the lookout for those kinds of things. Our third strategy is to identify and address the logistical needs of vaccine distribution. Just to be clear, we're not actually distributing vaccine locally. So the health department or the city of Waco or McLennan County isn't going to receive a large shipment of vaccine and then decide who to distribute it to. That's being done at the federal and state levels. But we're just making sure that any providers locally that have questions or needs related to storing or administering the vaccine, that we can help them work through those challenges. One of the vaccine candidates, the Pfizer vaccine, has some pretty stringent storage and handling requirements. It has to be stored at an ultra low freezer temperature. And so just making sure that providers locally have the tools and guidance that they need in order to handle the vaccine appropriately. And then ultimately, fourth strategy is that we're of course planning for community-wide or mass vaccination efforts. So once the supply of the vaccine gets to a point where we do receive a large shipment, we definitely want to be able to get that out as quickly as possible. And so we are planning for some kind of mass vaccination clinic. I can't put a timeline on it specifically because it's very dependent on when we get, that large allocation. But I do feel pretty confident in saying that it's probably going to be sooner rather than later. I think we were expecting it to be more closer to the spring or summer when we were going to kind of see those things happening, just based on the expectation for what the supply was going to be. But when they opened up the phase 1B, and that being such a large group of individuals and the vaccine just being pretty readily available, we're getting a steady supply or steady shipments or allocations, both locally and across the state. I would anticipate that we'll see some of those mass vaccination efforts start here in the next few weeks. So that is really it from me. I just want to leave my contact information up for a second.
Okay, I think one thing, excuse me, Stephanie, go ahead.
I was just going to say that was it. So if you have any questions, feel free to.
I think, we're getting a lot of calls in my office about this, and the plan is really good, but the execution is limited by the supply, the vaccine that we get, and we don't control that. That comes from state and federal, as you mentioned before. But the best thing we can do is just ask people to find out, go to the providers and get on their list. That's the key thing. And then the other thing that I'm finding a little bit odd is people say they call their general practitioner and they're really not scheduling anything for them, from what I understand. But we might clear that up on Wednesday during our press conference when we have representatives from the medical community there and find out how they're grasping it as well. Are there any questions anyone would have, any comments?
I do. Stephanie, if you could, I've got several people that would fall into the category of 65 and over that just obviously concerned, when can they get it? Do you have a time frame that you feel confident, if you're 65 and older and you want it, that you will have the opportunity to get it? Would it be in the month of January? I mean, can you put a time frame on that so when people do ask questions, we can give them an educated answer?
I can't give a specific time frame. I would say that, I only anticipate our supply to increase. So every week I anticipate, us to receive larger and larger allocations to our jurisdiction. Right now, one thing I didn't mention was the nursing home or long-term care facility vaccination efforts. And so those started the week after Christmas as well. So 5 facilities in McLennan County were scheduled. All of the long-term care facilities in McLennan County, with the exception of 5 really small, like less than 20 bed assisted living or personal care type homes. All of the others have been enrolled in a federal pharmacy program. And so a large chunk of the supply of vaccine right now is going to that program. And so at the federal level, there's still a very large, allocation or supply increase from week to week, but locally that's being taken by the long-term care facilities currently. So, but I do feel like by the end of January, February timeframe, you're going to start to see the supply open up, and you'll be able to get the vaccine for those that want it pretty available.
Okay, and then one other question is, I know on a call that I was on with you, we discussed the jailers. And I know it provides for healthcare workers in an environment such as that, but did we get our jailers included in that?
Everything that I have heard in the presentations that I've been on, they have been very specific to say that they were very deliberate in their healthcare definition. And so they did not include jailers outside of the specific healthcare staff in that definition.
Okay.
So I can't say that it was included necessarily in any specific allocations locally.
Okay, thank you.
Cover that group.
So Stephanie, you said there was a pivot that we were going to vaccinate our sheriffs, our deputies and things like that. But that changed. Is that correct?
Yeah, so there was some planning assumptions that were made that phase 1B was going to include critical infrastructure personnel. And at the federal level, they did put in at their guidance level to include critical infrastructure personnel, which would include law enforcement and other first responders and such. But Texas, like I said, decided to take a different approach. And the advisory committee at the federal level it's just guidance. So it can be taken and adjusted at the state level. And so Texas decided to go in the route to cover those more vulnerable populations that were more at risk of contracting severe disease. And so that's where the pivot came from a little bit on our end, just trying to adjust expectations a little bit.
I don't have a question, but I would like to just interject along with Stephanie's presentation that the Vaccine Planning Coalition, along with myself, Elodia, and Ana Picasso from Human Resources, serve on that coalition. We've been meeting since December 3rd, and I just want to thank Stephanie for all of her due diligence and the information that she is trying to get out to the community. And we did get a little shock when the Commissioner of State Health Services added the 1B group to the vaccine distribution now. But I know they're working really hard. And I believe that there are still meetings with the hospital presidents. I'm not sure, Judge, if you all are still having that meeting, but I think one of the discussions that probably should happen as we move into the future is how do we transition and start bringing in that 65 and older group quickly to get the vaccine, because a lot of people are a little anxious, probably because the commissioner in his press release, he put in that statistic that said that individuals 65 years and older comprise 70% of our COVID deaths. And I think that has a lot of seniors on edge. So when we start having those conversations about how do we start making the doses that we do have in McLennan County accessible to that population, that vulnerable population, I think it would be good to have that discussion with those hospital and pharmacy providers.
Okay, and that is a main part of discussion that'll be this coming Wednesday. As this information comes in with the help of Stephanie and all of her professional folks. And but when that announcement came out from Dr. Hellerstedt, I think there were some vaccinations given into the 1B categories in that area, but some of the providers did not follow what he suggested is going to 1B, so they stuck to the initial plan of 1A. So, you know, there again, supply will solve so much problems here. We've got a good plan here. We just need the vaccine to be able to distribute it. One thing that was a while ago when we talked about the positivity rate, you know, I asked a question because I didn't think that was correct. Actually, the surge testing positivity rate for this county was 10.31%. Now, there is a excess of 30% of our hospital beds taken up by COVID patients. And, you know, anytime it's over 15%, then that's when we reduce capacity in restaurants and businesses and those things. Just make clarification on that.
Okay, but is that cumulative positivity rate not 34%?
I'm not sure. I mean, all I know is what the positivity rate is on the surge testing.
Okay, because I know on the covidwaco.com website, as of January 3rd, that's when they're posting that 34% positivity rate, and I guess that's for all tests. And they're posting that 27% as the 7-day rolling average.
Okay. Okay. All right. Anything else anyone have?
It was a good report.
Yeah. Stephanie, thank you very much. Good report. And Elizabeth, thank you as well. Okay, let's go to the consent agenda items, and recommended pull is item E3A. It's an HR matter for our Sheriff's Department. Are there any other pulls recommended by the court on the balance of the consent agenda items? If not, is there a motion to approve the consent agenda with the exception of the pull on E3A?
Motion to approve.
Is there motion made and second? Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Dolson,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Okay, I'd like to go to item, item Q5 on page 10. This is a report from Jared Goldsmith regarding the voting center discussion. So, Jared, are you online?
Yes, I am. Can you hear me?
We can.
Very good. I'm going to share my screen. Give me just a second here.
All right.
Okay. Can you see my map?
I can.
Very good. Okay. So we're going to start out. I'm just going to kind of review some of the vote centers that we currently have, as well as the early voting centers, and just a few items that we have to cover for the May city and school election that we have coming up. First of all, the list that you see here on the screen, these are the current election day vote centers that we have. We have 34 vote centers. These are the vote centers that we used in November of 2020. We just ran a successful election with these sites. So don't have any super recommendations to change any of these sites. Does anybody have any questions about these? Should be familiar with all of them by now, I would imagine, for the most part. No? Okay. One note, we did add the St. Louis Activity Center over by Riker for the November 2020 election. This is in precinct 38. It's this one right here. We added this site under the recommendation from the Texas Civil Rights Project to cover an underserved voting population in that area. Just as a reminder, that was one of the changes. We did also have to move the Episcopal Church of the Holy Spirit that's located behind Target over to the Waco High School Performing Arts Center. The church bishop wouldn't allow the public in there. So we're going to stick with both of those sites going forward for now, unless a change needs to be made. As far as the May City School elections, here's what I'm proposing. We're going to be using 23 sites, election day sites. We have 23 entities who are wanting to contract with McLennan County. One of the only changes we're having to make at this point with election day is we can't use the First Assembly of God Church. And that's actually going to be early voting and election day. Unfortunately, the church is not allowing us to use their site during May city and school elections. We will be able to still use it during November and primary elections. The church is growing, and they just felt like they couldn't handle us for all of the elections, so they asked us to not hold the May city and school election there. Instead of First Assembly of God, we will be using the West Waco Library. This was a per City of Waco recommendation. We were going to use this in the May 2020 election. Obviously, that election got postponed to the November election, so we did not. This site, it's less than 1 mile away from First Assembly. It's located at the old Lake Air Mall behind Cotton Patch on Bosque Boulevard. So it's still very close to First Assembly, and it is still in Commissioner 3's area. Commissioner 3, Commissioner Jones, I believe you were aware of this change. Very good. So that's the big change at this point. A note for 2021 is that we will be going through redistricting this year. So there may be some changes that you may want to consider as far as when you're making redistricting changes. One that I would recommend is voting precinct 38. That's at Bishop, the St. Louis Activity Center, excuse me, over by Riker. This is in Commissioner 3's district. Possibly consideration is maybe changing 42 and 38 between the commissioners. That way, both Commissioner Jones and Commissioner Miller, you would have an even 9 election day vote centers, and it would just kind of make things a little more even. So just something to consider in the future. Another change that may be coming is a vote center, an election day vote center at Baylor. We in the past have had a polling site at Baylor. I believe it was at a fire station, and we had it at the Wheathorn Center. But due to parking and scheduling conflicts, Baylor asked us to leave. And it's been interesting to me that we don't have a site over at Baylor. And I think it would be a good idea to possibly move one over there to Baylor. On top of that, there is proposed legislation for this upcoming Texas legislative session. House Bill 93 is the designation of polling place locations on the campuses of certain institutions of higher education. In this bill, they're proposing that the county should designate a polling place location on the main campus of a general academic teaching institution as defined in the Texas Election Code, located within the county if that institution has at least 8,000 students enrolled. And that would be Baylor University. So, Judge, I know that we spoke about this a few weeks ago, and that I believe there was some talk with some representatives over at Baylor about possible sites. Do you have an update on that? Or
No, other than that they've informed me of the legislation that's that'll come before the folks in Austin to vote on that, which it's gonna cause quite a few changes across the state, you know, with many big colleges in those areas. But I don't know any more about it than that.
Okay, all right. Well, I can get in contact with somebody over at Baylor and see kind of what recommendations they may have.
Well, let me say, I'm sorry, excuse me.
There you
go. They said that if it that they would like to have one whether this legislation
Sure.
passed or not, and they would provide all the workers the space and those things. So that's as far as the conversation went.
Sure. Okay. Well, that would be great. I mean, if we could get a working relationship with the university to figure out kind of, the logistics of it, what would need to be done, where we could do this, that would be great. I think it would be great also to have one over on the university campus. I know a lot of major universities, it's almost a requirement that they have a polling location on their campus.
I had a
Um,
question, Jared.
yes.
Just really quick, while we're talking about institutions of higher learning, we have vote centers on the MCC and TSTC campuses, correct?
We have one at MCC. We do not have one at TSTC. We used to have one at TSTC. I don't remember the reason we moved it. Was it due to? I'm sorry. I have Terry here with me as well. Just FYI.
It was when we had the reduction and when we went to both cities.
Okay, yeah. When we moved to vote centers and we reduced the number of sites, that was one that was removed. I don't believe it was used very much. Correct?
Correct.
Yeah, it was one of the. It was.
And MCC has less than Waco campus less than about 3,000 students.
Okay, yeah, and the TSTC campus, it has less than 3,000 students. We actually called TSTC yesterday to just verify, well, how many students do they have? So I don't believe it would be affected by this bill as far as TSTC goes. MCC, yes, we do have one over there. It's at their conference center. It's the old Waco High School building.
Mm-hmm.
So we do have it there at MCC.
And just reiterate that we had tried through the years to go back to Baylor. However, parking was a huge issue.
Yeah, and as Terry was just telling me, parking was the issue with Baylor. We have tried to go back over there. It's not that we've completely ignored Baylor University. It's just that the logistics of it have been a little more difficult than would have been ideal. So.
Okay. I guess my thought would be to have the continued conversation with Baylor, but I would also like to see, not really, but in addition to, I'd like to see perhaps if we could have a vote center at each of our institutions of higher learning.
Sure. Yeah, and we can look at TSTC in the future as well. Like I said, it wasn't used very much, which is part of the reason why it didn't make the cut, I guess you could say. We do have one right across the highway from TSTC at the Lacey Lakeview Civic Center. And there's one at Belmead Civic Center as well, which is not too far from TSTC also. So,
Well, it goes in a different direction, but if I'm thinking right, the activity we had at the bookstore, the Wythorn Center,
yeah.
Was low, but I think if you put it there, especially with the new trend in young people and engaging in the democratic process, we may see a different turnout.
Absolutely.
If we give them another opportunity. And that's why I just think it's well worth the effort to look at having them at all of our institutions.
Yeah, and I don't disagree with that either. So, we do want to make sure that the students are involved. Now, if we are to move to Baylor, one of the things I would propose is to
Hey,
actually.
Jared, I have a real quick question for
yes.
you.
Go ahead.
I'm not sure how it works, but are Baylor students registering at their address at Baylor, or are they keeping their home registration where their driver's license and things like that are tied to?
I don't have like a specific number as far as that goes. Just kind of what I've experienced. I know during the bigger elections, like this past presidential election here in November, we had a lot of Baylor students who did register. There were several voter registration drives going on at the university with different.
So they registered in McLennan County, is
yeah,
that
to
correct?
register here in McLennan County, yes. I know the athletic department, they had a big voter registration drive that to register a lot of the athletes. Go ahead.
Last minute, we had a huge surge in limited ballots.
Yeah, and we see a lot of Baylor students vote what's called a limited ballot, they'll come in during early voting, and they have to come to our office to do this. If they're registered in another Texas county, but they're living here at Baylor or living here in McLennan County, they can vote a limited ballot, and that limited ballot lets them vote in contests that would appear on both the McLennan County ballot and their former county ballot only. So like they couldn't vote on local issues on that limited ballot. And during the bigger elections, such as the presidential or the governor's election, we see a lot of Baylor students come over and vote limited ballots. When they vote a limited ballot, that does register them here in McLennan County and unregister them in their old county. So for what that's worth.
And Jared, I want to just real quickly, we need to be careful. If we start opening up sites again that have very limited use, we've got small communities that have far greater turnout than probably some of the smaller colleges would, yet they
Sure.
have to drive 15, 20 miles to vote. So I think we
Right.
need to keep our residents in mind just as much.
Of
as we
course,
move forward.
absolutely, absolutely. So, I think we have a good distribution right now with the 34 election day vote centers that we have. And remember, this is just election day. This is not an early voting site that I'm trying to add here or make a change to.
Well, I think that the bigger question is the early voting sites. I think
Okay.
that needs a very thorough and study, because
Okay.
there's lots of people that want to early vote that don't have a early voting site near them and have to travel far away, especially in the outer parts of the county. So
Sure.
I definitely would want to take a look at our
We'll take a look at that here.
early voting sites.
We'll talk about that here in just a minute, because I am going to cover early voting sites as well. So, last thing I'll mention with the Baylor site, if we were to change or move to Baylor, I would want to change one of the sites. I would want to move the Waco Convention Center site over to Baylor. The Convention Center has been proven to be a bit problematic and cost prohibitive. Cost is one of the big things. When we use a private church, we give them $30 typically for payment for that election day use. For this past November, the cost for the convention center was $1,339.25, which is a lot more than what we're used to paying out. Other issues with the convention center, like I said, just difficult to work with. To them, elections are a secondary priority. Obviously, they book events well into the future. And when they've booked up the convention center, they'll stick us in a room in the back, and it's hard to get to. So that's been an issue. It's also been an issue with scheduling equipment drop-off and pickup with them. So if we could get away from convention center to Baylor, that would be nice as well. As far as like distance to other election day sites that are surrounding the convention center, the distance over to Baylor from the convention center, which is over here in precinct 10, it's right around 1 mile. The district to the Waco Multipurpose Community Center is 1.5 miles. And then the the distance to Cesar Chavez is less than 2 miles. So there's still a good amount of coverage in this area. I don't think it would affect that too much.
Gary, we're running short on time, so can you kind of finish up?
Okay. Yes, I will. I will move it along. So let's go ahead and go to early voting sites. So this is what we have right now, as we are all aware. Do you have any questions about these sites?
I don't. I think this is a wonderful presentation. Perhaps for the judge's sake, we should have did a work session. But just to comment on your last statement,
Yes.
I'm in favor of doing the research to see if a site is feasible over on the Baylor campus. But I would also like to see, before we just take away a downtown site, because I know I received a lot of calls when we were unable to go into the convention center. A lot of people were concerned that they couldn't vote in the downtown area. If we could look at, if not that public facility, but look at a facility that still would meet the needs of people who vote in that downtown hub. You know, you can move it as far up to 18th, however that downtown sector does. But I did get calls, and I do understand, and I feel for you on the complications we have with the convention center. We may need to look for another site, but I wouldn't just eliminate it
Absolutely,
from
and
the site, but look at something else in the downtown area. But not to
absolutely,
prolong it.
and like I was saying, we do have Dewey very close by as well, but we can look at that, and we'll look at that in the future as well. Okay. As far as early voting sites go, I'm trying to move
Jared.
this along a little bit.
Jared, hold
Once
on.
again,
Jared, hold on.
yes.
There's a question from
What's the
Commissioner Smith.
distance from the convention center to the elections office where elections are held?
Oh, less than a mile. Now, the election office can only be an early voting site.
Right,
We
right.
just don't have the facilities to have it during election day. You have to remember, after the polls close on election day, this is our central counting station. We convert all of this area down here to our central counting process, which is receiving the equipment from all of the vote centers across the county.
Okay,
And also we have ballot board that meets down here during the weekend and that day. So it would be great if we could have an election day site here. Unfortunately, we just don't have the room to do so
Okay.
due
Thank
to
you.
election day processes.
thank you.
Okay. So early voting sites, these are the 5 early voting sites. An issue for the May city and school election is the city of Waco has asked for an extra early voting site. Right now, I'm planning on using all 5 of our established early voting sites because we have so many entities who are planning on contracting with us. This is not typical. We typically only use 3 to 4 early voting sites during a May city and school election, but I do want to try to give all of these entities equal access as much as we possibly can. The city of Waco, like I said, has asked for an additional early voting site, a 6th early voting site in their City Council 2 district. This is a map of the city of Waco's district. In the May election, they're having one here in this blue section, which is District 2, in this brown section, which is District 4, and in this yellow section, which is District 5. 5 and 4 both have early voting sites within it. They've asked for one in District 2. They were looking in the South Waco region. Personally, I don't believe that this is necessary to add an early voting site for this particular election. And I do not intend on adding an extra early voting site for the May city and school election. I think including a 6th early voting site, honestly, is going to be a waste of money, energy, resources. You're just not going to have the turnout for this election. The reasons that I don't think we should be adding this extra early voting site is, first off, the city of Waco already has 3 early voting sites within the city limits that we are intending on using. The one at the West Waco Library, of course, the Records Building downtown here, and then the Waco Multipurpose Community Center. Many entities do not have any early voting sites. And unfortunately, we can't give every entity its own early voting site. It's just simply not feasible. We've received some complaints from other entities that we already are using too many early voting sites. The cost of the early voting sites is shared between all of these entities. And if we're adding an extra early voting site, it's really not fair to those entities that are not going to be using it and that cannot have their own early voting site. Second reason is May city and school elections have a low voter turnout. This past November, the presidential election, we had over 70,000 people vote early. in person at one of our 5 established early voting sites. And we did this successfully. Compare that to the average May City and School turnout. Over the last 4 May City School turnouts, elections, the early voting turnout has been less than 5% of that 70,000. It's been around 2,000 to 3,000. So you're talking about a huge swing in the number of turnout voters. So, and for that reason, a 6 early voting site, I don't see it being necessary for city and school elections. The third reason is adding a one-time site can create voter confusion. Our office is aiming for consistency in our sites to avoid this voter confusion. When sites are moved, this leads to complaints. And actually, one of the biggest complaints that we receive is when a site gets moved. So we want to avoid that. We want this consistency in our polling locations.
Okay.
Fourth site, the records building seen here, it already sits on the border between 4 and 2. So it's right there as is, kind of serving both of those communities already. And then the 5th reason is, I'm going to pull up this chart here. If you look at early voting percentage turnout for the city council districts, the numbers just don't add up to for this need to add one there in District 2. So District 2 is the one that's wanting that extra early voting site. You can see I have the city council districts, the registered voters in those districts, and then the percentage of turnout during early voting in each of these city council districts, and if they have an early voting site or not. And if you look at City Council District 2 here, their early voting percentage turnout was actually higher than in City Council District 4, which does have an early voting site. Same thing can be said here. District 2, no early voting site, higher percentage turnout during early voting than District 1, which also had an early voting site. To me, these numbers, they just don't add up to show that there's like a real serious need to add this 6th additional site. So, and if you look on election day, let me pull up my other map here. Give me just a second.
Jerry, we really need to hurry. We've got a whole agenda that we've got to get to.
Okay, one last thing here. We are gonna, in District 3, or in District 2, excuse me, we do have 3 election day sites, plus Hard Texas Council Governments is right there. I don't think that this is necessary. I don't plan on adding this additional site. I hope that you'll support me and back me up in this, because we don't need to create this additional work. And that's what I'm going to tell the city of Waco. So let me know if you have any questions, and I'll try to move on so y'all can get going.
Okay. All right. Any quick questions for a quick answer?
Just a good report, Jerry. Thank you
Yeah.
very much.
Thank you.
Very
And
thorough.
one last thing I want to add real quick. The cities do have the option to conduct their own election if they want their own early voting site. We want to run their election for them. Elections are very complicated, very difficult, and this is what we do, and we're good at it. But they do have that option as well. So just as an FYI.
Okay. Thank you.
Thank you very much for your time.
All right. Okay, going back to the pulled consent agenda item number E3A. It's a HR matter with SO. So Dustin, if you'll address that and then pick up the agenda from there.
Yes, sir. So the McPups deputies, as y'all know, we're not having inmate work crews working at this time. So those deputies have been working at the jail to help with staffing issues related to COVID. And so this is a request from the sheriff's office to pay those McPups deputies overtime in the same way that the jailers are paid.
I make a motion to approve.
Second.
Motion made and second. Any other discussion? No other discussion. Call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you. Okay, Dustin.
All right, Judge, did we want to do H3?
Yes.
All right, this H3, authorization of short form of agreement and related proposal for professional engineering services with Lockwood Andrews and Newnham Incorporated regarding County Line South Road at Tawakona Creek drainage study. Zane?
Morning, Judge and Court. Yes, this item is for LAN to do a drainage study on the Tawakona Creek on County Road South. The amount is for $9,500. And the reason we need to do a drainage study is that section of road in Precinct 3 continues to get washed out every time we have a minor rain event. And so we're hoping to determine how big of culverts we can place underneath the roadway to allow the water to pass beneath the roadway to prevent the road from washing out in the future.
Okay. I agree with, we should do this. Is there some old information where we did some research years back? It seems like we did, but I'm not for sure. It would be in your office though.
We have history of that section of roadway washing out multiple times a year.
But
the
no
past 10
study,
years.
no study was done. Is that correct?
And not to my knowledge, no, sir.
Okay. I'd make a motion that we approve this to get started on it. Is there a second?
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you.
All right, moving to item F, budget, under F1 regarding the FY21 budget. Francis?
Yes, sir. So we have just a few budget amendments for fiscal year 21. Starting with F1A, this is in the general fund for the JP Collections Department, and they are needing some additional funding for their monthly cost related to the TransUnion Solutions access. F1B is a budget amendment for the Permanent Improvement Fund related to the 2019 bond, and there's an additional amount needed for the garage relocation. And that is related to a concrete pad that will be installed behind the building. And F1C is a certification of revenue. We are certifying the proceeds that were received from Mortenson Construction, and this was in regards to some road damage that was caused by that entity, and then we were reimbursed $3,047. We're certifying because this was not money that we were anticipating or before the budget was adopted for the year, so it wasn't included in budgeted funds. There is also a budget amendment attached. So the request is to increase road construction materials in Road and Bridge 2 for that same amount, and this will allow Road and Bridge 2 to make the repairs to those roads for the damage that was caused.
Okay, is there any questions on those? If not, is there a motion to approve F1A through F1C?
So moved.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones, Commissioner Perry.
Aye.
Pass. Under F1D, Dustin?
This is the McLennan and Hill Counties Tawakona Creek Water Improvement District discussion and/or action regarding funding requests for baseline water quality study. We had checked with Dr. Lear back in mid to late December, and he was still waiting to hear back from some of the entities, so we request this be deferred at this time.
Is there a motion to defer?
So moved.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
I think he's left the meeting.
Commissioner Perry.
Aye.
Pass.
Under item G, G1, authorization of cleaning and disinfecting services quote from All Around Maintenance. Ken?
We've been contending with that this has to do with the COVID cleaning, extra cleaning that we're doing. And we were taking a look at what we were doing, and we decided to kind of renegotiate some things. We reduced the number that we have working on this cleaning and just kind of set up a new contract. We received a quote from All Around Maintenance to provide the courtroom disinfecting cleaning, and they're service would consist of 3 people working 5 days a week, Monday through Friday, 8 to 5. During those times when the courtrooms do not need disinfecting, they will clean various other areas. All around maintenance will provide this service for $150 per person per day, and we will only pay for the day's work. If the court approves, the contract will begin January 4th, 2021, and we will not exceed $50,000 level.
Okay, any questions?
Now, is this gonna start once we start trials again, or is this effective immediately?
We're still having to do some cleaning or disinfecting, even though we may have to readdress it if the trials start in earnest.
Now, right now, even though the activity is low in the courthouse, there's still plea bargains and all hearings and all those things that are taking place. So the protocol is that we have to clean after each one of those.
Okay, this would include JP courts, district courts, county courts at law?
Yes.
Okay.
Yeah. Any other questions? Okay, what's the pleasure of the court?
Make a motion to approve.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Under item H, H1, authorization of business associate agreement with Network Sciences Incorporated. Heather?
Yes, sir. Good morning.
Morning.
So Network Sciences Chassis, that's our web-based software that we use here at the Indigent Healthcare Program for our community health and social services system. And through an inquiry of just HIPAA compliance and how our health information is being protected, we discovered that there was not a business associate agreement in place. So that's what the purpose of this is for. We did have a software license agreement and a non-disclosure agreement, but after visiting more with Dustin and IT, we determined that this would be just some extra protection for the utilization of our program.
Okay, what's the pleasure of the court?
Move to approve.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Under H2, authorization of master service agreement with AMG Technology Investment Group, doing business as NextLink Internet regarding Road and Bridge Precinct 2. This will upgrade the bandwidth at Precinct 2 and actually be a cost savings. There'll be a $600 annual savings and get us improved service. So we just need a motion to approve this master services agreement.
So move.
Is there a second?
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you.
All right, under H4, authorization of support and maintenance agreement with Excella Technologies regarding records management. This is a support and maintenance agreement for Digitech Paperflow Choice, OCR, and Digitech Papervision Enterprise totaling $2,483.89, which is a small increase from last year. And the term of this contract is January 30th, 2021 to January 29th of 2022.
What's the pleasure of the court?
Move to approve.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, under I1 regarding ADA renovations at Extraco Event Center, agreement with John W. Irwin Construction, authorization of application for payment number 7. Ken?
Yes, sir. This amount is $21,479. Dustin and I both reviewed this, and it's CPNY signed off on it, so this should be good to go.
Okay, any questions? Not, is there a motion to approve?
Motion to approve.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
I-2 regarding Spiegelville Road Improvement Project, agreement with Knife River Corporation South, authorization of application for payment number 10. Zane?
Yes, sir. Payment number 10 for Spiegelville Road, issued by Knife River, has been reviewed, and it is in the amount of $1,105,329.74. Project is roughly 70% complete and is on schedule and within budget. The payment application number 10 is recommended for approval.
Okay, is there a motion to approve?
So moved.
Is there a second?
Second.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, under item J, J1 is authorization of deed without warranty, authorization to convey interest to City of McGregor regarding Lot 2, Block 2 of the J.H. Hall Edition, City of McGregor. Zane?
Yes, sir. This is a lot in the city of McGregor that was recently discovered. It is owned by the county, and the county has no need for this lot. So we've been in discussions with the city of McGregor, and they are willing to accept this lot from the county. And so we have created a deed without warranty. It's recommended for approval to the city of McGregor.
Okay, any questions? All right, what's the pleasure of the court?
Motion to approve.
I'll second. Any other discussion? Call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, moving on to item K, under K1 regarding the Bureau of Justice Assistance Adult Drug Court and Veterans Treatment Court Discretionary Grant Program, authorization of agreement for data management and outcomes assessment services with Sarah L. Dolan. Part of the grant requirements are that there is a data management and outcomes assessment to be done. Dr. Dolan will serve in that role. She is a licensed psychologist and will be paid $50 per hour and will spend 2 hours per week doing this work.
Okay, any questions? What's the pleasure of the court?
Move to approve.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Under K2 regarding the Texas Indigent Defense Commission Indigent Defense Improvement Grant Program, we have two items under here, K2A and K2B. I believe Judge Hodges is on the line. I can touch on the first one. Back on November 17th, the court approved the appointment of members to the McLennan County Mental Health Assigned Counsel Program Oversight Board. There's a need to update the representative from MHMR, and the new board member will be Wendy Key. And then under K2B, this is a request to make an adjustment to the budget for the grant. The Indigent Defense Commission has already approved that adjustment, and the county would be responsible for 20% of the adjustment, totaling $1,890.
Okay, are there any questions? If not, what's the pleasure of the court?
Motion to approve K2A and K2B.
Second? I'll second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Right, under K3 regarding Office of the Governor, Criminal Justice Division, County Innovations to address commercial sexual exploitation grant, authorization of grant application. David Ives.
Yes, this is just a continuation of our sexual exploitation program and us applying for the grant, turning in our certifications, and just us expressing our interest as well as the county expressing their interest in continuing this program.
And no match required, correct?
Correct.
I'd make a motion to approve K3.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Under K4 regarding the Coronavirus Relief Fund Grant Master Service Agreement with BKD, authorization of invoice. This is the invoice from BKD totaling $90,000 for their services in helping us submit our reimbursement requests. And I know Francis is on the line. Francis, I believe we've now have received our total allocation through the reimbursement. Is that correct?
That is correct. So all documentation has been submitted. Everything's been approved by Texas Department of Emergency Management, and we've received all the funds. So it's right under 2.4 million. It's very particularly $2,383,865. So we were able to account for all of that money and receive the total allocation to the county.
All right,
Is
is
this
any,
the final invoice?
Yeah, this was the one and only invoice for their services.
okay, any questions? All right. Not, is there a motion to approve?
So moved.
Second.
Motion been made, second, any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Under item L, Department Office Specific Requests, under L1, Constable Precinct 1, discussion and or action regarding additional fleet vehicle. Judge, is Constable Strickland in the audience?
Yes, he's coming to the microphone. Good morning.
Good morning.
Morning.
Hey. Judge, what we're asking for here is a spare vehicle, if you will. We have a fleet of 8 vehicles. When one of them goes down, we have 4 that are still very old. And there's many times we'll have one in the shop for a week to 10 days. And the way we have to compensate for that is I give up my vehicle and drive a personal vehicle so the deputies can get their work done in the field. And then we're requesting to keep, we just got a vehicle and we're requesting to keep one that we have in the fleet now, which would increase us to 9. It will not require any additional maintenance funds, fuel. We can operate, we just need a spare vehicle.
Okay, are there any questions?
Motion to approve L1.
Second.
Motion been made, second, any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Thank you.
Thank you.
Hope the rest of your day's this evening.
Under L2, County Sheriff, authorization of phone request for the Jack Harwell Detention Center. This is a request for 6 voice over IP phones for Jack Harwell, and this would allow the attorney visitation to be managed in a similar way as it is done at Highway 6. Total cost for those phones and the licensing would be $1,692, and there are funds in the IT assessment fund that can cover those, and then IT and maintenance of buildings will take care of the cabling that would be required.
Okay, any questions? If not, is there a motion to approve?
So moved.
Second.
Motion been made, second, any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, moving on to item M2, discussion and or action regarding deferring payroll tax obligations. And Judge, we've kept this deferred and would request we do so again.
Yeah, we still haven't heard anything about those being waived, and so the reason why we've deferred it is so someone wouldn't defer that tax and then have to pay it back, and so we're waiting for any announcement from the federal, any federal legislation that would cause us to act on this or not. So,
Motion to defer.
is there a second?
Second.
Motion been made, second, any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Okay,
All right.
pass. Go ahead.
M3, discussion regarding healthcare plan audit and related engagement agreement with Messier 42. We are still working with Baylor Scott and White Health Plan to obtain the data and working through any associated costs, so we'd request this be deferred again.
Is there a motion to defer?
So
So
moved.
moved.
Second.
Motion been made, second, any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
M4 is acceptance of oath of office documents for elected county officials. This is the acceptance of the oath for Randy Riggs, Parnell McNamara, Will Jones, and James Smith.
Okay, this is that time again, and it's a good opportunity to tell Commissioner Smith, welcome to the court, and you're gonna, I think you're gonna enjoy most of this.
Appreciate it.
And the parts you don't, you'll forget soon. But I want to congratulate all those who were reelected and have taken the oath to uphold local laws and the Constitution of the United States. So is there a motion to approve?
So move.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, under M5, authorization of appointments to the Criminal Justice Advisory Committee. HotCog is requesting authorization of appointments to the Criminal Justice Advisory Committee. There will be 2 vacancies on the board, so the court will need to appoint 2 members to replace those spots. So, Judge?
Yeah, what I asked for HotCog to send their recommendations because they do they want to be sure that they're fitting in the with the backgrounds to be able to provide support for this program. So by the next, I asked that we defer this, and the next board meeting we will have a full list to vote on.
Motion to defer.
Is there a second? Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass. And I would say that on any of these appointments, if any of the commissioners have ideas about who might ought to go on those boards, bring those forward so we can share them with the HotCog board or any other group that we are providing board members for. So, okay, we have a motion and a second. Call for a vote.
We already took vote on it.
Oh, we did vote. I'm sorry, I did make a post comment too. Thank you. All right, Dustin.
Under M6, Tax Increment Reinvestment Zone Number 1 East, City of Lorena and McLennan County 381 area. This is recording of the Lorena TERS semi-annual report for January 2020 through June 2020. And Judge, we just need a motion to approve that report for recording purposes.
Okay, is there a motion to approve for recording purposes?
So moved.
Second.
Motion been made second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
And Judge, if it's okay, we can take M7 and M8 together. M7 is approval of order adopting the fee schedule for the felony cases, and M8's approval of misdemeanor court-appointed attorney fee schedule. These are for the appointed attorneys and have been submitted by both the district court judges and the county court at law judges.
Okay. Any questions?
Motion to approve M7 and M8.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, we have nothing under item N. Moving on to item O, the venue project. Under O2A, we have authorization of application and certificate of payment number 23 for John W. Irwin, general contractor. Ken, or I can handle it as well. This is application and certification for payment number 23 totaling $1,415,970. And it has been reviewed by Ken and I, and Populous was on site last week and has signed off on it as well.
Okay, any questions? Not, is there a motion to approve?
So moved.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Under O3 regarding engineering services agreement with Walker Partners, O3A of the authorization of invoice number 010314.0.01-19593. This is an invoice from Walker totaling $275, and it was for the final plat of the venue area.
Okay, is there a motion to approve?
So moved.
Is there a second?
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
Item P, McLennan County Radio Tower Project. P1 is ratification and authorization of tower project expenditures. Ken?
Yes, sir. Through the projects, Precinct 1 and Precinct 2, there's been small expenditures that come up to keep the project moving forward. Those amount to $33,728. Just various things. There was some missing connectors that we needed to buy. There was work on a foundation for the generator, and we had that generator hooked up. We had various electrical parts. So we come to ratification for those expenditures, those circumstances. And if I will, I'm on to P2. We have sought permission and permission to install the antennas at Road and Bridge 1. But we have everything in place to install the antennas at Road and Bridge 2. So I'm seeking permission for an amount of money to go ahead and issue that PO to Gulf Coast Steeplejacks to all antennas as well. We can get that so that they can do one trip down here. If there's any questions.
Okay. I think we heard most of that. Any questions anyone have?
I make a motion to approve P1 and P2.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, Judge, I believe that's all the action items, and we will have the one executive session item.
Yes, sir. And that would be under 551.087.
Yes, sir.
Of the government code regarding economic development. And so we're going to go into about a 5-minute recess and then come back under executive session. And then we will come out, and then then we will conclude, unless there's other comments or questions anyone would have, conclude this session and then go into our PFC board meeting, which will be quickly followed. All right?
This meeting is being recorded.
Ready. Okay, let's call back into regular session. Going back to the regular agenda, is there anything else that we need to cover? If not, we will stand adjourned and then give us a few minutes and we'll go into the PFC meeting. Stand adjourned.